The Nigerian Center for Disease Control and Prevention has issued a health advisory following the outbreak of diphtheria, a bacteria that affects the nose, throat, and sometimes the skin of an individual. Today, this is our focus. Good evening, I am Olasumbo Modupe. The program is Sound Health on Lagos Television. The conversation begins after this break. Please stay tuned.
This is the story of health. No, it's not just about eating your vegetables and growing taller. It's about how the world's people came together to help us all live long and healthy lives, making amazing discoveries like new medicines and vaccines, guiding us to grow up healthy, strong, and happy, keeping us safe from nasty diseases, painful ones, and deadly ones. And some horrible ones you've never heard of, because they were completely wiped out.
The end of smallpox, the magnificent chapter in international collaboration.
This long-awaited malaria vaccine is a breakthrough for science.
Has finally been declared free of wild poliovirus.
It was really a story of human perseverance, innovation, commitment, bringing communities together towards one unified goal.
This is a story about all of us, because we all played a role. And if we can keep working together, we'll make more discoveries, have more victories over diseases, and help even more people be healthy and happy in the future.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Yahya Disu, Head Risk Communication, Nigerian Center for Disease Control and Prevention. And he is going to share his expertise and prevention tips on diphtheria. Good evening, Dr. Disu, and thanks for joining us.
Good evening. Thank you for having me. Happy New Year.
I wish you the same. All right, thank you so much, Dr. Disu. Dr. Disu, diphtheria is the most recent disease outbreak in Nigeria. Tell us, what exactly is this disease?
Well, diphtheria is a vaccine preventable disease. It's one of the disease that we give vaccines for at the age of 6, 10, and 14 weeks in childhood. And that's to protect them against catching the disease from the community. So because it's one of the killer diseases, just like measles, TB, and so on. Now, it is a respiratory illness, and it has symptoms like cough, fever, sore throat, running nose. And then sometimes somebody could have a swollen neck. And then if he gets to advanced stage, it could be patches, like white patches in the throat, that if you open the mouth and look at the back of the throat, then you'll be able to see that swelling. Sometimes it can obstruct, it can affect swallowing, it comes with pain. So that's the challenge, that the complication that can come with diphtheria. Though it's treatable if it's detected early, because it's caused by bacteria. Antibiotics can be given and complications can be managed. But the best way to handle it is to prevent it through childhood immunization.
Why is diphtheria regarded as the most feared of all childhood diseases?
Well, anything that causes death, right, will be feared. So it's one of the childhood killer diseases. Like, it's not the most, but it's one of the common childhood killer diseases. Just like you have measles, cholera, right? And then cholera and diarrheal diseases, not really cholera, diarrheal diseases. measles, pneumonia. So diphtheria is also one of those diseases. And no country, no government, no parents would like to go through the process of pregnancy, delivering the pregnancy. The babies have rights, or the children have rights to live, and nobody wants to see them die. So that's why it's important that a program has to be in place to prevent it. That's why immunization is given, and then also facilities are in place to detect the onset of this disease and then prompt treatment to prevent complications like death from the disease.
All right.
It spreads
Okay.
too as well among the vulnerable population, people who are not immunized. So it's very, very important because of that reason as well.
Before we take a look at the prevention tips and how to reduce our risk, let us look at the recent updates issued by the NCDC. About 4 states have been affected by the disease. Let us have the recent update.
Well, according to our last situation report, which was on January 28th, it's 38 deaths, but a new situation report will also come out to update Nigerians on what has happened. Where all the figures are cross-checked, because these reports are from states, the states that are affected. So we have teams deployed to those states currently, working with the state authorities, Ministry of Health and other partners working in the states to ensure that they are able to stop the transmission and then reduce deaths from this disease. So by the time we get the new situation reports, we get updated on the new developments.
Dr. Disu, are there types of diphtheria?
No. What you just have is diphtheria is caused by the bacteria. So, and we can't say that we have type just like we have the SARS coronavirus.
Apart from fever and sore throat, are there other symptoms one must watch out for?
Yes, symptoms can be categorized as general and specific. So fever is what you see in all the infectious diseases. And then when you say sore throat and then runny nose, they are characteristic of respiratory illnesses. But for diphtheria, there is a particular patch in the throat. It looks like white patch that covers what we call tonsils, or the back of the throat that you can see. So that's peculiar. And then you also neck swelling can also be associated. And then, of course, general malaria and any infectious illnesses can come with other complications. Overwhelming infection, whereby the person may not be able to move, or the person is bedridden and all those things. So it can come with any other non-specific symptoms, loss of appetite and all those other signs that can also be detected.
According to your explanation earlier, you said those who have not been vaccinated against diphtheria vaccines are mostly affected. Have we seen cases where persons who have received the full dose or dosage of penta vaccines infected?
Investigation is ongoing now. Most cases that have been reported are people who did not take this vaccine, right? You have to take the 3 doses. So the more cover you have, the better for you, the better protected, as in the number of doses you have taken. Somebody who takes just 1 dose, you can't compare the level of immunity with somebody who has taken 3 doses of pentavalent vaccine. So, but more investigation can actually let us know if actually there are people who also suffer diphtheria who have who have been vaccinated. But a lot of things can also happen to immunization. Like for instance, it is not sometimes if the cold chain at the time the vaccine is given, if the vaccine has lost its potency, right? So the person may not be fully protected or may not be protected at all. And the person will also regard himself as the person is vaccinated. And then the administration, the scale of the healthcare workers giving the vaccines, those are things that can go wrong at the point of vaccination. It's just like any other immunization process, whereby at the end of the day, it is not everybody that gets vaccinated that may be protected, maybe a certain percentage. For some, naturally, they are not able to convert to develop antibodies, but those are very few proportion, and very few cases that we see in our population. They constitute a negligible proportion of the population.
All right.
But the important thing is everyone needs to be vaccinated. Yes?
Are there other risk factors to be wary of?
Yes, of course, because it's a bacterial infection. It's caused by an agent that lives in the environment, poor sanitation, and it can also spread this. And then overcrowding. Since any respiratory illness, whereby you have crowded space, and you have an infected person, and the person is coughing, breathing out droplets, then definitely people around are at the risk of getting it, especially if they are not vaccinated or immunized. So those are the risk factors. Close contact with somebody who is showing symptoms, and then particularly if you are vulnerable, as in you have not been vaccinated against the diphtheria.
Okay, Dr. Disu, I would like you to use this opportunity to enlighten members of the public, especially parents, on the essence of routine immunization at this time.
So, just like you said, it's an opportunity to continue to remind us. Mothers, when they go to clinic, they tell them they give vaccines to their children. Childhood vaccination is important. So diphtheria is one of those diseases that we prevent against. So it is free. And the only thing it will cost you is walk down to the health facility and make sure that you don't miss any of the vaccination. Is to protect the child in the future. Because if it's not vulnerable now, if it doesn't get exposed, you will be exposed later. And then the only way it can be spared is if he has been vaccinated. So go to any primary care centers around you, and then go there, of course, with your immunization card, because it's expected that that would not be the first vaccine you will be taking. Right from birth, children are given vaccination, they have schedule. So Penta is one of those schedules that they have to take. If you know that vaccine is not available in the center, report to the authorities so that you'll be able to and then do the needful to ensure that these vaccines are available. So I think that's what we have to tell the mothers. Then not just mothers, even the fathers have responsibility to ensure that their children are immunized, and they go to the center, support the mothers, even though they say can take these children, create time, and to ensure that they get the vaccine as at when due. And then if anybody is showing symptoms of diphtheria, just like what we mentioned earlier, they need to report either to the primary care center or the nearest facility around them, so that this confirmation. Fathers also have responsibilities to ensure their children are immunized. They need to support the women, and then in a situation whereby they have the time, because most times fathers will be at work, they can also take the children to the center to get the vaccine, and also follow up to ensure that the child does not miss any of the doses in the schedule. So it's very important. And I said, in case a child is showing symptoms that looks like diphtheria, cough, runny nose, fever, sore throat, next swelling, they need to take this child to the hospital to be diagnosed early, so that the person can receive care to prevent a worsening of the disease. Also prevent spreading it to other people who may be vulnerable around. Also message for our healthcare workers that they need to have high index of suspicion, especially in this time. And then there are cases that come to them in the hospital, and they may just try and also query diphtheria and report to the disease surveillance notification officer in their local government, who can arrange to take samples to verify, to confirm the diagnosis. The earlier the diagnosis is confirmed, the faster we can control this outbreak.
Your call to action as we wrap up this segment.
Yes, it's responsibility of parents, responsibility of people, neighbors, to ensure that every child around us is immunized. And then we also urge our government authorities at every level to ensure that the facilities are made available to make sure that every child is reached. Where the facilities are not close to where people are, they need to organize outreaches, support, provide the necessary logistics to take these vaccines to hard-to-reach locations, because every child has the right to access this vaccine. If anybody has symptoms or shows symptoms around you, I'd encourage the person to report in the nearest health facilities so that they can receive care and then follow up with the contacts to make sure that we stop this transmission. So healthcare workers should maintain high index of suspicion and report the cases immediately to the authorities when they see any.
Take responsibility to protect yourself and your loved ones. Dr. Yahya Disu, Head Risk Communication, Nigerian Center for Disease Control and Prevention. Thank you so much for your expertise on the program today.
Thank you for having me. You're welcome.
I have been speaking with Dr. Yahya Disu, Head Risk Communication, Nigerian Center for Disease Control and Prevention, on the diphtheria outbreak in Nigeria. Sound Health continues with trending health report from around the world. Please stay tuned. Well, the program is still Sound Health on Lagos Television. More to come in a moment. right, this is where we say thank you on today's episode of Sound Health. Parents and caregivers must ensure their children are fully vaccinated against the diphtheria disease. If you're feeling any of the symptoms shared by Dr. Disu, visit any of the health facility around you. If you have any topics you would like us to treat, make sure you send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.